Good day, future RMPs. I am Ma'am Ron and I will be explaining the post-laboratory discussions for exercise 1, 2, and 3 of Clinical Chemistry 1 Laboratory. So we start off with exercise 1, which is the familiarization with laboratory apparatus and equipment used in clinical chemistry laboratory. For the table of contents, we have introduction, objectives, and questions for research. For the introduction, every profession has their own and unique weapon. For a carpenter, it can be a hammer. For a chef, it can be a knife. For a doctor, it's his stethoscope. And for us medical technologists, we should know and remember the different laboratory apparatus and equipment we use with the heart. Laboratory instruments and apparatus can affect the accuracy and precision, so we first recall what we mean by accuracy and precision. In the picture, the center or the target reflects the true result, and accuracy is how close the measured value is to the accepted true value, while precision is how close repeated measurements are to one another. So, calibrating and checking our laboratory instruments and apparatus is very important or critical to achieve dependable results. Clinical chemistry shares many of the basic apparatus and equipment with other sections of the laboratory. However, measuring devices like pipettes and volumetric flasks and equipment like the spectrophotometer are more commonly encountered in this section of the laboratory. For the objectives, you were able to get familiarized with the different laboratory apparatus and equipment or instruments, and you were able to obtain the basic understanding on the use and principle of each. For the question for research, you were asked to draw, label, and state the use of each of the following equipment or apparatus. We start off with spectrophotometer. It is an instrument that measures the amount of light absorbed by a sample. It also measures the concentration of the solution and can identify organic compounds by determining the absorption maximum. In this picture, we can see the different parts of a spectrophotometer like the on and off switch, the sample holder for cuvette, wavelength and absorbance readout, the mode selection buttons, the wavelength control, and the 100% transmittance control. In this image, we can see the different components of a spectrophotometer like the light source, the sample compartment for the cuvette, and monochromator. Next is a water bath. Water bath is used for maintaining a uniform temperature throughout the fluid contained in a glass container by keeping it in a preheated water. It also prevents excessive evaporation of fluid being heated as compared when we use flame to heat fluid. It is made up of insulated metal, usually stainless steel, an electric element or heater to heat the water, a propeller or stirrer to circulate the water in order to maintain a uniform temperature, a thermometer that can be built in or placed separately, and a thermostat to maintain the temperature at a constant level. Next is a centrifuge. A centrifuge is used in clinical laboratory to separate substances of significantly different masses or densities. The two substances to be separated can be a solid and or a liquid, or two liquids of different densities. In a clinical chemistry laboratory, centrifuge is used primarily to separate clotted blood or cells from serum or plasma in body fluids. If we recall the difference between serum and plasma, serum is obtained by letting a whole blood sample to clot at room temperature and therefore would lack clotting factors. Unlike serum, plasma is obtained from whole blood that is not left to clot and contains serum along with clotting factors. In this picture, we can see the parts of a centrifuge, which includes motor, the control, the chamber, the latch and lid, the rotor, and the sample holder. Next is analytical balance. It is designed for very precise measurements of very small samples. They are meant to detect very fine increments so the slightest vibrations or breeze can impact the results. Analytical balances have a draft shield or weighing chamber to prevent the very small samples from being affected by air currents. As such, analytical balances should be used in a dedicated room with as few disturbances as possible. Next is a top loading balance. It is among the most common types of weight measuring scales used in the laboratory. As compared to analytical balance, this balance does not have a draft shield. It is a balance with an open weighing pan loaded directly from the top. Next is a micropipette. The primary use of a micropipette is to aspirate and dispense a defined volume of liquid accurately. The volume of liquid is measured in units of microliters. There are several sizes of micropipettes used. Examples would be P1000, P200, and P20, wherein the number would indicate the maximum capacity of the micropipette. The P1000 measures volumes between 100 to 1000 microliters. The P200 measures volumes between 20 to 200 microliters, and the P20 measures volumes between 2 to 20 microliters range. In the image, we can see the different parts of the micropipette like the push button, the finger hook, the tip ejector, the volume display, tip ejector collar, the tip cone, and the pipette tip. Next is a pipette tip. A pipette tip is a disposable attachment for the uptake and dispensing of liquids using a pipette. The sizes of the pipette tips are color coded like P200 seen as color yellow, P1000 seen as color blue. Next is a serological pipette. It is a glass or plastic equipment used to measure and transfer liquids. They may be reusable or disposable and usually used for volumes of 20 ml or less. Next, we have borosilicate tubes. They are handheld glass tubes that normally are used for mixing or heating liquids and or chemicals at the laboratory. Borosilicate glass is resistant to temperature change because it does not expand like ordinary glass, and from its name, it is composed of boron and silica. Next is an Erlenmeyer flask. In some references, it is also called as conical flask. It is used to contain liquids, and it is an apparatus having flat bottom and a long narrow neck which allows easy mixing of the solution without spilling its content. Since the flask has a narrow long neck, it is also used to gently heat the content inside with a gentle swirling motion. Next is a volumetric flask. This is one of the most important glassware of any laboratory. It is made up of glass and is calibrated to hold a precise volume of liquids at any precise temperature. Different sizes are available and each are calibrated for exact measurement of liquids and solutions. It is mostly used in the preparation of standard solution, and a standard solution, we mean any chemical solution which has a precisely known concentration. Next is a graduated cylinder. It is used for measuring the volumes of liquids from a few millimeters to many liters. So how do we read a volume using a graduated cylinder? After putting the graduated cylinder on a flat, level surface, the second step in reading a volume using a graduated cylinder is to position your eyes with the level of the surface of the liquid as seen in the picture. The water in a cylinder will form a curve called meniscus. The meniscus is formed when the sides of the cylinder pull the water up to the sides. This is due to what we call adhesion. Lastly, we follow the lowest point at the surface of the water to the wall of the graduated cylinder. Guys, try to read the volume in this example. The answer is 24. You are correct. Next is a beaker. A beaker is a glass vessel used to hold mixed or heat substances and liquids. Beakers are cylindrical utensils with a flat bottom and the upper opening having a rim around it along with the spout. The spout aids in the proper pouring of solutions. They are used, and we should take note that beakers are not meant for precise calculations of solutions. Next is a thermometer. It is used to measure temperature, and it can be either a partial immersion thermometer, which can be used to measure the temperature of water baths, heating blocks, and ovens, while total immersion thermometers are generally used to check refrigerators and freezers used in the laboratory. Next is aspirator valve. This device is placed on top of pipettes for generation of vacuum to transfer known volume of liquid, usually from one container to another. Next are vacutainer tubes. Vacutainer tube is a type of test tube that has a colored rubber cup on top of it. This rubber cup helps to create a vacuum within the tube. It is either made up of plastic or glass, and the vacutainer tube is sterile within and generally consists of certain constituents like EDTA, sodium citrate, heparin, and sodium fluoride. In clinical chemistry, we commonly use the red and yellow top. Next is a vacutainer adapter. It allows the attachment of the vacutainer tube. It also assists medical professionals in protecting the patient from the risk of needle stick injuries. Next is a vacutainer needle. It is a multi-sample blood collection needle that offers a simple, effective way to collect blood while reducing the possibility of needle stick injuries. These needles are double-sided. When we were in third year medtech, one of my groupmates tried to press this part without knowing that a vacutainer needle has double-ended needles. So she was punctured. So always be careful when using any apparatus or equipment. As shown in the figure, the major components of the vacutainer needles are the bevel, the shaft, the threaded tub, and the rubber sleeve covering the needle. The sizes of the needle generally range from 1 to 1.5 inches with a gauge value ranging from 19 to 22. Please take note that the higher the gauge, the smaller the hole. Next is a syringe. A syringe is used to draw blood and other body fluids for testing. It is used to introduce medications via intravenous, intramuscular, or intradermal route. Next is a cuvette. A cuvette is also known as a cell. It is used to hold the sample in the light beam of the spectrophotometer. It also provides the interface between the sample and the spectrophotometer. As seen in this figure, the cuvette may have a mark to indicate the front. Always hold the cuvette by the opaque face and place the clear face into the path of the spectrophotometer light beam. These are our references. Thank you for listening.